Hey all you Loganites out there. I'm just calling out to you for a weekly update. I know it's been more than a week, but life is as is, right? C'est la vie. Had some weird things happen this past few weeks. I saw my first adult COVID patient, because I work with kids, and basically what I'm seeing is kids are like the little petri dishes. They're the little carriers. I mean, I've seen a few kids that have been sick, but they look like severe bronchiolitics or asthmatics. They really don't look like anything special, honestly. Most of them I've seen are just normal, just happen to pop positive, until recently. Recently I've had a lot of pediatrics that were all trauma patients that get admitted that pop positive for COVID. I've been exposed like 6 or 7 times in the past 3 shifts, if not more. I've gotten so many calls or texts. Hey, that patient that you took care of on blah 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 that had blah blah blah, they have the COVID. So I'm just calling to let you know that you need to take it careful. You can call our hotline, yada yada yada, whatever. Okay, I've already done 1 quarantine. I know how I feel about it. However, I will say this, that my job is now offering short-term disability if you do pop positive with corona, where even though I was quarantined for 14 days, I did not get any kind of financial benefits. I got nothing. I could use my vacation time if I wanted to. I didn't have any. Anyways, I saw my first adult full-blown COVID patient the other day. I was over at Germantown in the pediatric side. Went over to the adult side to help start a line, and it was on a COVID patient. And they asked us beforehand, they're like, hey, do you feel comfortable just coming over here and helping us on a COVID patient? I was like, I don't mind, it's our job. Like, if she needs a line, she needs a line, so I'll come on over there and help out. So I grabbed the ultrasound machine, we go over there, and man, it's rough, man. It's really bad. It looks like pulmonary hypertension, okay? They're super sweaty. They got that oxygen hunger in their eyes. You feel like they've got fluid on their lungs. I mean, it looks like they're just like pulmonary hypertension, fluid overload, something like that, where they are like really, really sick. I'll be honest with you, it kind of scared the shit out of me. It's making me take this a lot more seriously, I'll tell you that. Because she wasn't old. She was like, I don't know, like 50-ish, 50s, overweight, diabetes. But even then, it still shouldn't have, in my mind, been that bad, right? Because it's just the COVID. It's just COVID. I don't know, man. I don't know. But it's definitely got me second guessing some things. I had my first nursing residence meeting, I guess it's a meeting, the other day in 3 months. So, stuck in Europe, came back for the next residency meeting. It got canceled because of the whole COVID stuff. The next one got canceled, the next one got canceled. So 3 out of the 12 months I'm in this program got canceled, and we're able to make up the time in the class. So that tells me that we eliminated a lot of BS. Ooh, there's a stop sign coming out of nowhere. So that lets me know that there was a lot of BS in the class that we cut out. And I'll be honest with you, the first meeting I went back to, it felt like that. It felt like we cut out all of the BS, all of the filler, and we've just got the important stuff. Well, part of that important stuff was listening to risk management talk about good and bad patient outcomes. The risk manager from where I work, she's well known throughout the system. She just speaks so amazingly. She makes you feel like you're in the situation. She makes you feel like it's your patient. And these mistakes, but basically what she does is she tells you, like, starts off with a good story and then a bunch of bad stories. A bunch of times where nurses just kind of blew off the vital signs, saw out of limit vital signs and just rationalized it. And once they rationalized it, they stuck to that rationalization until the patient died. They never second guessed themselves. They just let it keep going, that kind of stuff. Like, they didn't ever did ever stop and pick up the anchor they set down on that first rationalization. And it's easy stuff to do. It was easy for these people to do that. That scares me. That scares me a lot. It makes me go, well, what have I messed up on? What have I been around and not noticed? Did I have a patient that had a pneumo? Did I have a patient that, you know, was bleeding somewhere? Where did I mess up? Because if it's that easy to mess up, I have totally messed up. I know I have. But where? When? How? Who knows? Doesn't matter, right? You know, you do what you can, you move forward. But it gave me anxiety just listening to her. It gave me intense. I was sitting there like, man, I need a freaking Xanax. I need a Xanax. Can I go for it? I need a Xanax right now just to like complete this class. Hold on, I think I'm about to have to turn around. They're doing some tree work up here. They're cutting like some trees with a big, I don't know what the fuck that is, a bucket truck or something. About how long you think it'll be? Huh? About how long you think it'll be?
It's gonna be a minute or so. He's gonna have to get the brush off the road and stuff.
All right, I'll flip it around. I appreciate you.
All right.
So anyways, listen to the risk manager. Had like I said, a lot of COVID exposures lately. And I had my first patient with, so the risk management was a thing, okay? Like that really did kind of mess in my head a little bit. I even came and talked to my preceptor, my friend, my mentor, Debbie. I was like, yo, look, this is a bit much. It's kind of intense. There goes Ben and Caleb, about to grab them. They're cutting trees up there. It's gonna be about 20 minutes. Can you find a workaround, Caleb? All right, I'm following y'all. Wait, where are you going? What the fuck are they doing? Anyways, I talked to my mentor. I'm like, hey, look, this is kind of scary. This is a bit much. She's like, yeah, that's nursing. And I was like, oh, okay, well, that's different. So then I go to work, and the next shift, I've got not just a trauma patient end up having COVID, not just a patient that just happens to get tested for COVID that's here for something completely different. I had a patient that had COVID and also needed legitimate nursing care, which hold on. What's up?
Hey, did you turn around?
Yeah, no, I didn't. Where are y'all going?
Oh, they're letting us through.
Oh, motherfucker. That bit lied to me. Are they still letting people through?
Yeah, you better. Yeah, they are. They're letting us through.
All right, here I come.
Bye.
All right, bye. I tell you what, you can't trust the tree trimmer. I hope I can make it through there. This motherfucker again. trimmer. I swear. Tree doctor, Les Ben calls them. Ridiculous. Ridiculous. Alright, so back to the gist of the story. I took care of this patient that had legitimate medical issues. Also positive for corona. This is my first time having to deal with the logistics of like getting all of your stuff prepared before you go in there, going in there, or putting on all your PPE, going in there, doing everything you have to do, and then coming out. Now, he just happened to be there for, let's say, a central line issue, or a PIC line issue. Someone that has like one of these big, large gauge, deep accesses. Okay, so go in there, gotta do all of these little things just to get them checked in right, then gotta give these meds, gotta do this other stuff, and then I gotta start a line. Okay, so I get all my stuff ready to go back in there to start a line, got all my stuff in there to get them ready to go upstairs, got all my stuff ready to go do all this. I should have known that someone that needs such a like large bore, deep access is gonna be a hard stick. I should just go in there with the ultrasound machine. I should just go in there prepared that he is gonna be a hard stick, okay? But I'm a good stick. So I don't really, you know, I'm gonna go in and stick at least once before I break out the ultrasound machine, right? I didn't account for, with all the PPE, you wear double layer of gloves. So you got double layer of gloves, and then a mask on top of your head, on your face, that's all scratched up because you've had to reuse them so much. Everything's fogging up. How can you find a vein on someone that's a hard stick with all of these extra obstacles? I'll tell you what, I couldn't. I sure as heck could. And I'm not bad. I'm not bad at it. So then I had to readjust, go get I had to get someone else to bring the ultrasound machine. Had to get someone to bring, didn't have an IV tray in there to begin with. Like just all these, and then you have to leave the IV tray in there because it has to be sanitized. Just all of these little things that you don't have to think about, now we have to think about. So that happened, okay? So you have all these exposures to COVID that just happened, okay? It's community acquired, unrelated to sickness kind of COVID exposure, okay? That comes into the hospital and then I get exposed. Then I had risk management come in to talk. And that kind of scared me because I'm like, what am I missing? Like, you don't know what you don't know. You don't know what you don't know. There is no way to find out what you don't know unless you experience it. There's no way to go in a book and go, hey, what do I not know? It's not gonna, it just doesn't work like that. You don't know what you don't know. You can't Google what you don't know because you don't know it yet. You know, once you come across it, then you can go, oh, okay, let me Google Hirschsprungs. I don't know. You can Google it once you know there's something you don't know. But you don't know until you know you don't know. All right. So then I had all this logistical issues just taking care of a sick but simple patient. Sick but simple. Okay. I can have up to 5 of these sick but simple patients. 5. I repeat, 5. I had 1. 1. Okay. 1. I think I would drown. I think I'm gonna drown when I get 5 of these patients that everything becomes a logistical nightmare. Everything is putting on all this extra crap and then taking all this extra crap off. And then you have to do it, you have to make sure you're active, mentally active when you're doing it, because you don't want to become complacent and start making mistakes or start cutting corners, because then you're just exposing the next patient to it, right? This is unrealistic and unfeasible. And what's scary to me is I have not yet heard of a plan how we're going to deal with it once we hit flu season and all of this stuff starts running together. Because like in years past, I mean, we just swim in the flu, I'll be honest. We don't wear any of the protective gowns, we don't put on any of the mask stuff, we don't do any of this stuff, we just get our flu shots. We just swim in the flu. Swim in it, man. Like, I know I'm going to be exposed to the flu every single day during flu season. Because kids get it and it makes them sick, man. It makes them super sick. And I'm okay with that. Because that's what it is. That's the risk. I'm okay with that. That's my job. However, you add on all these extra layers of PPE and logistics of trying to differentiate between COVID, flu, RSV. I'm sure there's a bunch of other viruses that I'm missing, because I'm not the sharpest tool in the shed. But when it comes to just the logistics of working in it, I got to be able to do it. So it's been a lot lately. It really has. It's been a lot that just kind of like compiled onto each other to make me go, what are we doing? Like, what are we doing? I don't know, y'all. I keep talking to one of my friends about moving to Hawaii, and he made the good point that they've got 0 cases there right now. 0 cases of COVID. I'd have to go into a two-week quarantine before I was, allowed to work and whatnot. But at least I wouldn't have all the COVID everywhere. I mean, only time's gonna tell how this flu season's gonna pan out, what kind of processes we're gonna have to do, all this stuff. I mean, there's so many moving parts in it. It's hard to even comprehend top down, bottom up, either way. But I like to end on a good note. I did say at one point I was going to be doing 2 videos a week, which I feel like is too much for me personally. And I've made some videos, like I did like the how to change oil in the Dodge. I don't enjoy making those near as much as I do just recording something I'm already going to do. Like, I don't enjoy those as much as like when I went to the Spring River and I recorded that, or like Tina and Scooter's 50th birthday party, where it's fun and it's already a thing, and I just happen to make it into, record it and then put it into like a pleasing watchable clip. I don't know how you say that. It's already happening, and then I just capture it and put it in a nice little tidy package. That's what I want to do. I'm not going to set out to find things to record. I'm just going to record the things I already want to do. I am going to try to do more like podcast type videos with like Ben and Caleb and people, and see how that goes. I really like those. I like those a lot. I do. I haven't said this before, but if you actually do watch my videos, please do subscribe and hit the like button. It's kind of cool to see it happen. Some random person did that the other day. He subscribed and liked my video. I don't know, I like it. It was really cool. I appreciate it when y'all do that. Well, I'm gonna sign out and go swim in the pool with Ben while he's in town. So remember, y'all, keep your corn on the cob.